Welcome to the Circuit of Success Podcast.
The Circuit of Success Podcast.
With your host, Brett
Gilliland. Brett Gilliland, Visionary Wealth Advisory.
The Circuit of Success Podcast. Let's start the show.
Welcome to the Circuit of Success. I'm your host, Brett Gilliland. Today I've got Kristy Shell with me. Kristy, how you doing?
I am great. Thanks, Brett.
See that nice sunshine in there, and you're down in Florida. I'm up here, but I will say, and you live 40 years in Illinois up here, and you know what I'm talking about. Well, we've had those snow on the ground for like 3 weeks. It's so weird, and it's finally going away. My watch says 54 today. I may just go outside and run around in t-shirt and shorts just because I can.
That is a nice day. You live for those days up there in January and February. I know.
Yes,
I won't
do.
brag about what our temperature is here today. I'll let you guys know that.
Yes. That is awesome. Well, you were introduced to me by good friends of mutual friends and actually a cousin of yours, the Hobbicks, and great people. So thanks to them for introducing us. We're going to have a great conversation today. I'm excited about what we're going to talk about. But so you have over 25 years of experience in the medical, health, and wellness fields. You're a dedicated nurse and board certified patient advocate, passionate about improving the healthcare experience. In 2020, you founded Haven Healthcare Advocates to offer compassionate and expert guidance to individuals and families navigating the complexities of healthcare. So that's a lot that we're going to dive into, but like I said, I'm excited about it. But before we dive into all that stuff, Kristy, I always like the big open question of what's helped make you the woman that you are today.
I love this. And I, of course, listened to your podcast. So I was hoping this question was coming anyway.
I'm not original enough to think of a new opening question. So for 418 interviews, this is what I'm doing.
I love it. I was hoping this question was coming because someone asked, like, well, what are you going to be talking about? I was like, well, I don't know what the questions are, but I was hoping this was going to be one of them. But no, I think what has made me the person I am, of course, all of the experiences that you have in life shape who you are, even more important, the challenges that you face. But for me personally, I think it's the people in my life. I am surrounded by great people, but even the ones that aren't so great have shaped me who I am. My mom and my dad, completely different. I was raised with my dad. For the most part, my teenage years were him and I, and, he told me I could be anything I wanted to be. I could do anything I wanted to do. My mom is in her 80s, and I've learned, kind of over the years, she has this quiet resilience about her. And I think that helped shape who I am. Certainly my children, 3 children, 2 grandbabies, more than they know, they have shaped who I am. And that's not an understatement. My loved ones, an incredibly supportive husband who is my biggest cheerleader for Haven Healthcare Advocates. And then every single nurse that I've ever worked with has helped shape who I am and what I do. That's
awesome. It's all about who we surround ourselves with, isn't it?
It is. Absolutely. Yeah. And again,
how are those grandbabies?
Have a place in there too. So
how are those grandbabiys?
They're amazing. They're actually going to be flying in tomorrow. So I get to physically squeeze them tomorrow. Awesome. Wow. It's the best thing. Great. Being a parent is great, but man, being a grandparent is nothing like it.
That's awesome. Well, you've heard the term, the sandwich generation, right? And I'll just use myself as an example. I have 4 kids, ranging from 10 to 19 years old. I've got parents. I won't say their ages, mom and dad, if you're listening. But so my parents are getting older, my kids are getting older, and I'm in the middle, right? I worry about my parents. I worry about my kids. Talk to us and to our listeners about Haven Healthcare Advocates, what it is you exactly do, and what the conversation we're going to have today is about.
Yeah, well, I think the best place to start is how I started, or why I started, my why I started Haven Healthcare Advocates. I too am that sandwich generation. I was living down here in Tampa. My dad was still back up there in the area, and he was going in. He was having some toes amputated as a direct result of his diabetes. And he knows that I talk about his private health information all the time. So I'm not.
We're not breaking any HIPAA rules.
No HIPAA rules here. I was able to go up there and be with him in the hospital, but I saw healthcare from the other side of the bed. So instead of being the nurse, I was the family member. And every time someone walked in that room, I felt like they had something wrong with his medications, his health history, his follow-up. And I thought, wow, here's a person who has a nurse as a daughter who's sitting bedside, and this is really overwhelming and can be very confusing. What about all the
Yeah.
people that don't have that in their family or their loved ones that are right there? And we have an amazing healthcare system. Like, medicine in this country is amazing, but the delivery of it can be very challenging. And so, Haven, the idea of Haven was exactly, an advocate, like having
Yeah.
someone on your side to help you guide through that. And that looks different depending on who you are and what your needs are.
Yeah. So what gave you the passion to want to go start the business? Because it's one thing to hear it, right? But then take the risk to go do what you're doing and starting the business.
Yeah, absolutely. So, well, it took me a little while to actually get from that point to launching the company. But in 2020, of course, healthcare changed for all of us as well, and it was a very difficult time. And that's where the leap of faith finally took off. It was like, okay, it's time to do this. I started solely with just me as an advocate, and the services, not a lot of people know the services exist, so just kind of word of mouth and just doing what we could to let people know what we can do. And so that's where it started. We've got 3 nurses and a billing specialist now on board. We help people all over the place. And, our philosophy is, our role is to make sure that you have and you understand all of your healthcare information so you can make the most informed decision. And from there, we make sure nothing falls between the cracks. So that looks a lot of different ways. We do everything from full care management. I always say, my dad, will use him as an example again. He did finally make it down here to Florida. But I do everything from him. I make his appointments. I attend his appointments. I go in, I fill his med boxes. I, make sure that every test that's supposed to be is done, and we do that for clients where we come in and we just manage everything, including keeping families up to date, because down
Wow.
here in Florida, families might be anywhere, all over. I've had clients that have families in other countries, and we're keeping them up to date on what's going on with mom and dad too. So, and then there's other clients that we work with that just, maybe there's just a small piece of healthcare that we're helping with. They're in the hospital. They don't understand what's going on. It's a new diagnosis. They don't know what next steps are. We help them find resources. Maybe it's a simple medical billing error. We help them. Josh is the one that introduced us, and I've been talking about this for quite some time, but they had a situation where I stepped in and helped them out, and then it was, that's kind of when that light bulb goes off, and it's like, oh, this is what we do.
Yeah. So walk through that. So we'll do a real world example. So, John and Sally Smith, mom and dad, something's going on there. They go in the hospital, maybe even onto the nursing home. I hire you. You come in and you basically take over and run the healthcare side. So me as a son doesn't have to worry about that. And I don't know the lingo. You guys know the lingo, or I'm also busy working and being with my family. I want to be there as much as I can for my parents, but it's hard, right? From a couple hours away to be at everything. So walk us through that and what that looks like. So when we have people listening to this, they know that somebody out there can be there for them and help them.
Yeah, perfect. So how our process works and how it looks: when we first bring on a new client, we do an initial intake assessment where we're getting a thorough health history. We're trying to find out as much information as we can about their health. And that might be, you telling us that about your parents telling us about that, going into their medical record and trying to pull it all together so we get a full picture of where they are now and where they've been. Now, I don't need to know that Dr. Smith took their appendix out in 1972, but as much health information as I can get so we know what that picture looks like for them. Then we come up with a plan of care. So what are their preferences? What do they want? I have clients that, they're later in life and they don't want a lot. They don't want a lot of intervention. So, we advocate for that. I have clients that want to live at home as long as possible. So we help them find resources for that. So we come up with that plan of care and what that looks like. And of course, with all of us, that changes over time, but, we come up with a plan to start with. And then from there, we can be as involved as they wish. So if they want us to do everything, we do everything. If they're in the hospital, we get on, we read the chart once a day. we talk to the bedside nurse once a shift or once a day, depending, because we all know, I know because I was a bedside nurse, but the nurses are the ones that are there 12 hours a day with that patient. The doctors see them for maybe 10 minutes. So we try that we read between the lines and get, really get a good idea of what's going on in the hospital. We work with the social workers at the hospital. So when it comes time for them to transition either home or skilled nursing rehab or to a facility, we make sure that that goes smoothly. We make sure that their medications are correct, that they're still getting the right medications when they're in the hospital and when they transition out. Whatever resources they need, we can help guide them in that. We keep a HIPAA secure portal, so families, depending on anywhere they're at, as long, and I do have to preface this by saying it's mom and dad's private health information. So as long as they're competent and can make decisions, they get to tell us who we can share with and what we can share. So as long as they're okay, families from anywhere can log into this portal and follow along and see what's going on with mom and dad. And what I hear most often when people find us and talk to us and move forward, they're like, before we've done anything, before we've even put pen to paper, they say, we just feel such a sense of relief knowing that we've got you on our side now. And what I find for families is that it allows you to be the son. You don't, you get that time with them. You get to spend time doing the things you enjoy, but still have the peace of mind that their healthcare is being taken care of.
Yeah. Which is huge, right? I mean, that's probably the biggest thing of it all, I would think of. But so in that example, the portal's there, mom and dad give you, access to that, however that works. And then I can go in there and then can I communicate with you as the son and say, okay, hey, how was that cardiologist appointment, or how was that MRI, or whatever it was? I'm going to get it in layman's terms back to me to see what the heck's actually going on with mom and dad.
Yes, absolutely. So you will get the actual records. We're in the process now of working with a new portal that's I'm really excited about. They are going to, and they're already out there. It's this company. I'm going to give her a little plug because she's amazing. It's a nurse that came up with this. It's called Primary Record, and you can aggregate all of the portals into one, and it pulls all the information in. So that's going to be there available for you. So you're going to be able to see the MRI report. You're going to be able to see the doctor's notes. But then on top of it, there's a communication piece that we can also have, that it is in layman's terms. And again, we can't give medical advice, but we're going to be able to explain things in terms that you understand. I always tell people, I can't give you medical advice, but you can also say, if this was your mom or dad, what would you do? And I can give you my opinion. So I never want to force anybody to do anything. Again, your health is your health, and people make decisions that I wouldn't make all the time. But being able to have that information, keep you in the loop, make sure that everyone knows what their options are, what it means. It's just an incredible peace of mind.
Yeah. For sure. What are the common missteps that you see out there that maybe the healthcare system is missing, getting it from the healthcare system to mom and dad to, caretaker, child, whoever it may be? What are those?
Yeah. So I talk a lot about on content that I put out. I'm always talking about Medicare and Medicare Advantage, not even with our older people. I'll even take it down to our generation and younger. People don't understand their insurance. So they don't understand what they've got coverage for, what their rights are. What I see so often are prior authorizations. You have to get this prior authorization, and then that doesn't happen. So they just drop off. They just don't do anything. Or you go to the doctor and you're supposed to have a chest CT done, but you don't do it. It goes by the wayside, and no one's following up on that. So it just doesn't get done. Medications are a huge issue, especially as we get older. And I've laughed because I now have an AM medication and a PM medication box. So I've become that person too. But understanding what medications you're on, understanding, when you're supposed to take them, making sure that they are ordered and delivered on time, dealing with the insurance companies. It's a lot. And our healthcare system is fragmented. Right hand doesn't talk to left hand. So, for instance, going back to my dad, when we were there, he was in the hospital having toes amputated as a direct result of his diabetes. But yet his endocrinologist, who is his diabetes doctor, didn't know he was there. So there's just this, electronic health records was supposed to, the whole point of that was to bring all that information together. And it just hasn't happened. If anything, information now is more fragmented than ever.
Yeah.
I see,
Well, it's nonstop, right?
It's nonstop. I see in portals that, I'm reviewing what's out there in your medical record, and they've got medications wrong. They've got diagnosis wrong. I've got a guy now who weighs maybe 180 pounds, 70 pounds. And he's tall, and, his medical record says he's obese. And I said, were you significantly bigger in your life? He's like, no, I've always been this size. So, there's so many errors out there too. So
Yeah.
Our healthcare system, while we have the best medicine, we have the best providers, there's definitely a fracture there. And there's some issues in our healthcare system.
Yes. Well, maybe Haven Healthcare Advocates can work on that as well while you're at it, right? All that free time you've got.
We're trying. We actually are involved with some national groups that we're trying to kind of get some traction in a few things. So.
Oh, good. Well, best of luck on that because we need it. What do you help patients advocate for themselves, like kind of almost like a coaching, if you will?
Yes, absolutely. I have clients. I have a client that's in, I always forget if she's Iowa or Ohio, and I know she's going to hear this because I'll post it. So if you know who you are, if you're listening to this, I always forget which state she's in. But I only talk to her a couple times a year, but she has felt like her doctors just weren't listening to her. And she knows she's younger, my age, which I think is younger. Used to think this was older, but now it's a lot younger. She knows her health. She knows her condition. She just felt like the doctors weren't listening to her. And she hired me. And all I do with her is before she has her doctor's appointment, we talk. And we talk about what she's wanting to accomplish for this appointment. And then the next day we have the appointment. I listen in. We make sure that she's heard and she's understood, and that she gets the outcome from that appointment that she's looking for. I've also written appeals for her through insurance because insurance was trying to deny a medication, and so went to bat for her. But yeah, part of what I want to do this year also is to teach people how to be their own best advocates also, because you have to stand up for yourself.
Yep. Amen to
and
that. Amen for that. But it's hard to do, right? Because pride and ego get in the way, and you don't want to face that mortality or that you're getting older and things are happening. It's hard.
It is hard. But if we ignore it, it doesn't make it go away.
That's true. Do you have any resources or tools that you use? Obviously, probably the portal, but is there anything else out there you use for managing like even chronic illness or chronic pain to recommendations for people? Like, how does that work?
Yeah, well, first of all, we've all gotten really good at being Dr. Google, right? Like if something happens, we're going to go on the internet and we're going to look it up and see. And it's not that that's wrong. You just have to know what you're reading and what you're looking at. So you need to know those resources and make sure that you're getting information from a reputable source. So if it ends in .com, be a little, it might not be wrong, but it may not be as trusted. So you got to look for good resources. And
I'm guilty of that.
Yep. We all are. Even as a nurse, I put stuff in Google all the time. But again, you got to know what you're looking at. Using your doctor's portals are really good too, because that information is out there. AI is going to play a part in our healthcare, and it can be a resource for us. So if you've got the doctor's language, you can use EI to kind of get that, ask it to kind of put it in layman's terms. So, I think we're going to be moving more and more in that direction. Knowing your insurance, reading what your insurance documents are, and finding those resources online, going to Medicare.gov, there's information out there that's helpful. Most places have like a center for aging, so you can get information, for aging loved ones. They're usually pretty good. But again, don't single source. Find that information. Make sure you're getting it from a good resource. We keep for us. We have networked and we know the other resources that are out there. Say, a lot of people don't know that placement agencies are out there. So if you're looking at trying to figure out where should mom or dad move if it's time they can't live at home, there's companies out there that will help you find, the right place. And it actually doesn't cost the family anything. There are private duty companies out there that can provide, they're self-pay, but they will provide companionship. They'll provide someone that can come in and be in the house for certain hours. Elder care attorneys, those are a great source. You need those because you want to be pre-planned. You want to make sure that things are in place because getting older is also very expensive, and you have things in place for that as well.
Yeah. What's funny is, I'm in wealth management, and it's funny. We talk about, your health and your wealth, right? They go hand in hand because if people only focus on their health and then they don't do anything with their money, guess what happens? Their health goes away, right? Because they don't have any money and now they're stressed and they have to work until they're 80 or 90 or whatever. But then vice versa, if you only focus on your wealth, your health's going to go away. So therefore, then your money's going to go away, right? And so we're huge advocates of focusing on both your health and your wealth along the way. And if you get those both going the right direction, that's the optimal way to live, right? And I think that what you're talking about, what you're doing, what we're doing, those two things go hand in hand.
Absolutely. 100%. I probably refer people to, those resources, more than anything. Make sure that your estate is in place.
Yeah.
You have things in place because, a lot of people don't realize, but if you can no longer live at home, Medicare is not going to cover for you to live in a skilled nursing facility or an assisted living facility. You have to protect those assets or, eventually Medicaid will cover that cost for a skilled nursing facility, but it's tough. You've got to be prepared.
Yeah, absolutely.
Sides.
What's the most rewarding part for you?
Oh my gosh. Hearing from families that, they just, the thankfulness that they provide. I had a client who, she had a cancer diagnosis. It wasn't a cancer that was ever going, it's never going to be, gone. She just has to learn to manage it. But the facility that she was at, the hospital she was at, they basically wanted her to just, not do anything. And they actually put her into a hospice home. And there's a whole big story around this, but it's way too long to tell the story. But I helped advocate for her. And this was a couple of years ago. And I get a picture of her sitting next to her Christmas tree with her family every year. And she would not be there if it wasn't for us and us, her family and us advocating for her because she was in a hospice home getting high doses of morphine, and she would have been gone within a week. And I get a Christmas picture.
That sends some cold chills right there.
Yeah, it is. I mean,
that's amazing.
We don't get into nursing because we know we're gonna, retire billionaires. We get into nursing because that's who we are. We have compassion and caring. And so, that's where the reward is when you know you've made a difference, and we see it. We see it all the time where we're making a difference.
I love it.
Yeah.
Well, Kristy, now I'm going to ask you a few questions about the business side. So we've talked about kind of the advocacy side and what you're doing there, but maybe share with the listeners, as a mom, a wife, a grandma, and a business owner, there's a lot of things going on in the world, right? How do you, one, focus and be an advocate for yourself as all those things I just mentioned? What do you do daily, weekly, monthly, whatever it is? What do you do to take care of yourself?
Oh, wonderful. So, I'm a big proponent of self-care. Every Sunday, if I try to whittle out some time that is just my time for some self-care. the biggest thing I do for myself and for my family is I do the best I can to say yes to my family whenever I can. Now I have to put a little asterisk next to that because my daughter that lives up there does ask me probably every week to move back up there. And I don't say yes to that. So, Lexi, I'm sorry, but
Sorry, Lexi.
I'm going to stay down here. But, I also in turn ask her to move down here. But, putting family first, and, it's hard when you own the company and you're trying to, and for me, this was later in life, as becoming this business owner and starting this, I was in my late 40s. So different time of my life. But putting family first and making sure they're the priority. I tell my clients, the nurses that work for me, we can't pour from an empty cup. So we have to be there for ourselves as well. So, I do try to move most days, depending, that looks different, depending on what the day is and what the schedule is, but, try to move every day, try to make those own appointments for myself. I have canceled appointments for myself because it interferes with, a client appointment, but I always go back and get those rescheduled. Yeah. So, you can't pour from an empty cup.
No. Amen to that. It's funny. I actually did my blood work today. I try to do it every January to go in, do my blood work, get, 3 pages of stuff. And, but it's important, right? And so I today walked around the office and, I had my little whatever, the stuff they put on there with the tape, little gauze and all that stuff. And and I walked around. I'm like, hey, does everybody get their blood done this week? Because it's like, I want to be an advocate for our employees as well. And whether they do it or not, I have no idea. But it's like, we got to go do that. And my wife and I have a foundation for cancer, and we know that the screenings are the best thing to lead to success with cancer, right? Is the things that we can control. Schedule the doctor's appointment. If you're a woman, go get your mammogram, right? Go do the skin checks with your dermatologist. Go do the blood work. Go do those things. Be an advocate for yourself. That's what we have to do. And it's in our control, right? Control the controllables, make the phone call. It's a pain in the neck. You don't want to do it. There's 100 other things I'd rather go do than give blood today, but I got to do it.
Yeah, you got to do it. You got to do it because, just because if you don't do it and you don't check it out, doesn't mean that something's not happening. Right. You can't stick your head in the sand. You got to know what's going on, and don't be afraid of finding those things out, because early detection is the key for everything. So don't be afraid to be an advocate for yourself and get those things that you need.
Love it. Kristy Shell, where do our listeners find more of you? Where can we send them?
We are on all of the social network places, Facebook, Instagram, LinkedIn. It is Haven HCA. And we try to share a lot of information and content on there to help you learn how to be not only your best advocate, but for you and your loved ones.
Love it. Well, thanks to the Hobbicks for the introduction, and thanks to you for your time on the Circuit of Success today. It's been awesome. Love the energy and love the conversation.
Wonderful. Thank you, Brett. I appreciate it.